I am Dr. Venugopal Reddy, Senior ENT Consultant, Sunshine Hospital, Secunderabad. Today, I want to explain about this small topic, acute otitis media in children. It can come in adults also, but very frequently this problem is seen in children. This problem is commonly seen in children. Why? Because children usually suffer with respiratory infection. Tonsils adenoids is the most common problem in children, causing cold. Because of this cold, what happens? Nose and ear are connected by tube. This is called eustachian tube. This tube connects in children, but children are more prone for infection because adenoids problem is there in children commonly, and also this eustachian tube is more horizontal. So the infection spreads very easily to the children. Usually they suffer with cold and sometimes the severe pain. Usually what happens? This happens in the middle of the night. They complain of severe pain in children. This is the common complaint because of the infection gone into the middle ear. Middle ear pressure changes and fluid accumulation is there that will cause severe pain in children. The most common cause is acute otitis media. If we neglect this problem, this tympanic membrane where it is there between middle ear and external ear, it may rupture. That is very thin membrane. Because of the fluid accumulation, what happens? It ruptures and fluid discharge comes out. That fluid is a pus. So people think the pain subsided and next day some watery discharge comes. So problem is solved. No. There is a perforation. There is a hole in the drum. Because of our negligence, because you have not taken medication in the right time, when there is a common cold, this sequelae came to the ear and there is a ear problem. So we have to solve this problem, and it can be solved very easily by antibiotic, ear drops and all these things. But we have to solve the root cause, because acute otitis media is the sequelae, that is follow-up of the tonsils adenoids problem in children, sometimes sinus problem. So we have to solve the root cause. Otherwise what happens? Because acute otitis media, we had gone to the pediatrician or nearby ENT, whatever, they give antibiotic, the immediate problem is solved. That is, discharge subsides by ear drops, but it may recur again. If it repeatedly comes again and again, the hole in the ear drum becomes very big, and very big hole means again child needs ear operation also. So this can be avoided when you solve the root cause, particularly in children. Tonsils and adenoids are prone for ear infections. If you remove the tonsils and adenoids problem in children, because of this root cause, completely ear problem is solved and there is no recurrence. So if at all a small perforation, it will heals completely and there is no further hearing loss or no other infection. So all the children suffering with ear problems, the root cause mostly is tonsils adenoids problem. So acute otitis media can come in adults also when there is a severe sinus problem, severe cold. So any acute otitis media can be treated by antibiotics, ear drops, even small hole is there, it can be cured. But we have to take care why the ear infection, what is the root cause. Mostly in adults, middle age or adults, this is sinus problem. So we have to identify the sinus problem, go to ENT doctor, they will do CT scan shows severe sinus problem, it should be treated by surgery. If it is mild, anti-allergic drugs, something like this. Medical therapy will cure your problem. So acute otitis media, usually ear pain starting in middle of the night. It should be treated conservatively, that by medication and other things. But whatever the root cause should be treated, maybe surgery is required. You have to identify and get cured by treating the root cause.